For years, the only way I kept up with healthcare was by cramming a year's worth of appointments into my short trips home, when I wanted to be spending my time catching up with people I missed. One experience overseas finally broke that pattern and changed how I handle everything related to my health. I've been traveling full-time for over 11 years, visited over 125 countries, and I've tried just about every health insurance setup you could imagine. Relying on my home country health insurance, short-term travel policies, and now a comprehensive international plan. I'm not a medical expert, but I have spent years building a healthcare system for myself that doesn't collapse when you move countries. Over time, I turned healthcare from a recurring hassle to a manageable, even a strategic part of my life. In this video, I'll walk you through the decision framework I use for insurance, the experience and cost of my recent Bangkok comprehensive checkup, the country-by-country approach I currently rely on for dental and specialist work, what still trips me up, and concrete steps you can take this week to make healthcare feel calm instead of urgent. And the shift started with something really small. There were years when I came home for a short visit, and I realized that too much of that time was spent bouncing around between appointments instead of with the people I came home to see. It always felt like I was catching up on healthcare instead of being fully present. That feeling of life being scheduled around medical logistics was the tipping point. I decided that I didn't want keeping up with my health to be something that stole my time. I wanted health to be scheduled on my terms, at least as much as possible. So I went back to basics and asked myself a few questions. Number 1, do I already have meaningful coverage at home? Number 2, how much time do I plan to spend abroad each year? Number 3, am I comfortable doing routine care outside of my home system? And number 4, what about less than routine care? If you have solid home coverage and you travel in short bursts, emergency-only travel insurance might be what's right for you. If you live abroad for most of the year or you don't have solid home coverage to rely on, a comprehensive international policy might be a better choice. Depending on your exact policy, these plans can offer coverage for preventative care, outpatient visits, and hospitalizations, potentially in every country around the globe. For me, I have health insurance in the US through my full-time job, but I spend 11 months per year outside of the US, so I wanted a policy that offered more comprehensive coverage for that time spent abroad. My comprehensive plan is through Genki. It's their highest tier plan with no deductible, and it costs about €280 per month. It works very well for the way I travel across many countries each year. My partner, Kevin, chose a very different trade-off. His plan is through Cigna Global and only costs about $80 per month, but has a much higher $10,000 deductible. Neither is right for everyone. One buys predictable peace of mind. The other buys a much lower cost, but more out-of-pocket risk if something happens. And since people always ask why I chose the Genki plan I did, it's because it has no coverage limit, which gives me peace of mind when I'm using healthcare systems across different countries, pays out claims quickly, typically in under 48 hours, and offers maternity coverage because my partner and I plan to have kids one day. Genki also offers a plan for about €180 per month that has a $1 million coverage cap and some other exclusions. But it's a solid option for people looking for comprehensive coverage with a lower price point. Previously, I also used Genki's emergency-only travel insurance, Genki Traveler, but I never needed to file a claim. The first time I filed a claim through Genki was after I switched to Genki Native for my comprehensive medical checkup in Bangkok. Since then, I've also filed a couple of smaller claims in different countries, including for a dental cleaning, which is also covered as part of Genki's offering. Both the payout speed and responsiveness from the Genki team has been noticeably good, which surprised me in a very nice way. And after I switched from emergency only to comprehensive coverage, my mindset around care shifted as well. It was an accumulation of small annoyances. Missed preventative care, the stress of scheduling everything during my short visits home, and the realization that if I could catch things in a predictable, affordable way, I'd save time, money, and anxiety later. Once I had a plan that covered preventative care abroad, I started using those benefits right away. That led to one of the best decisions I've ever made around my health. I booked a comprehensive checkup at a reputable hospital in Bangkok called Smithivaj. The appointment was organized station to station. Blood work, ultrasound, x-ray, EKG, and it took about 2.5 hours. I added a few blood tests that were recommended based on my family history, and I received 3 vaccines. The total for all of that was $785, and that was before my insurance kicked in. In the US, a similar set of tests would probably have cost several times more and likely have taken multiple visits. That morning in Bangkok gave me a simple, clear snapshot of my health and helped me plan everything for the year with much more confidence. For me, that clarity is worth the trip. Over time, I've built a map of where I go for what. Bulgaria for dental care. I see the same dentist every summer when I'm there. Bangkok for comprehensive annual checkups and vaccines because of the high quality and low cost of care there. Mexico for physio when I'm in the area because I have an awesome guy. We call him the body magician. The US has become my backup plan, and only because I still have insurance through my job. This isn't random, it's intentional. I choose a place for each service based on quality, price, and my personal comfort. But even with a solid system, some things are simply harder on the road. Continuity of care is the hardest part. Finding a provider who will follow a case over many years and across countries is rare. I've used a US doctor for continuity of care before, but it gets expensive. Genki's insurance only covers emergencies in the US without an expensive add-on. And we all know that healthcare in the US is expensive compared to many other countries. I'm currently exploring finding a provider outside of the US who will consult with me on an ongoing basis. Prescriptions can be awkward too. I either refill when I'm in the US and bring extras, or I try to get refills on the road. Some countries offer medications over the counter that are prescription only in other countries. These are solvable problems, but they require more planning than if I had a home base. Still, I think most people would be surprised about how doable it becomes once you take a few small steps. First, understand what your home insurance covers when you're abroad. Second, digitize your medical records so you can send them to any provider. Third, pick one city you trust for one preventative visit this year and book it. These steps alone help reduce the emergency feeling and turn health into something you plan for, not something you cram into the margins or completely ignore. And really, that's the heart of it. I'll be honest, I still struggle with this system sometimes. Healthcare isn't really set up to be done across borders. I expect to tweak providers, change insurance if life changes, and keep figuring it out. But the constant is this: treating international healthcare like a system instead of a series of panicked chores changed everything for me. If you're curious about specifics, the exact tests I had in Bangkok, how I keep my records, or the trade-offs between plans at different price points, let me know in the comments and I'll break it down in the next video. And if there's a part of healthcare you're most worried about while traveling, write that below. I'll use the questions to shape the next video. I hope this helps make the unknown feel a little more manageable.